The prospect of having surgery can be overwhelming to many people. It is a lot to take in a short period of time. We feel the more you know and understand, the better your surgical experience will be. This presentation will give you an overview of what to expect before and after surgery. If you have additional questions after watching this presentation, they can be addressed during your preoperative interview or by your healthcare provider. The first step to having an elective procedure is to register at the hospital. Your doctor's office will make an appointment for you to register at the surgical center on the Shenandoah Memorial Hospital campus.
Good morning.
Good morning.
Can I help you?
Yes, my name is Cindy Hunter. I'm here for the procedure.
This typically happens a couple of days prior to your surgery. At the registration, you will need to bring your insurance cards and a picture ID with you so we may make a copy. If you are going to be admitted to the hospital, copies of the privacy law and a booklet on living wills and advance directives will be given to you. If you have an advance directive or living will, please bring a copy of it with you at this time.
And this is your consent to do the procedure, and you just signed it.
During registration, you will sign a form giving your consent for treatment. Also, please be prepared to make your copayment at this time if it is needed. After registration, you will have a pre-surgical interview. At the interview, you will be asked for your medical history, your surgical history, a list of all prescription and non-prescription medications you are taking, and any allergies that you might have. If needed, a nurse will do an electrocardiogram or EKG. This will tell us how well your heart is working. You will also have blood drawn for lab work. These are both done to ensure you are a safe candidate for surgery. The nurse will also go over what you can expect when you come to the hospital and any pre-op instructions you will need to know, such as when to last eat or drink and when to stop taking certain medications. After you check in on the day of your surgery, you will go to the pre-operation or pre-op room. In the pre-op area, you will change into a gown, and your nurse will place an identification band on your wrist and, if needed, an allergy band. The nurse will verify your name, date of birth, your surgical procedure, your doctor, and ask if you have any allergies. They will also go over the pre-surgical procedures with you and will ask when you last had anything to drink or eat. As part of your physical assessment, your nurse will measure your blood pressure, heart rate, and temperature. They will also start an IV for hydration and medication delivery. From the pre-op area, you will be taken to the OR holding area. In the operating room holding area, your nurse will once again ask you to verify your name and date of birth, what surgical procedure you are having, and if you have any allergies. The reason that you are asked the same questions at least 3 times is for your own safety and well-being.
Good morning.
Good morning.
How are you? I'm Steve Palmerton. I'm one of the nurse anesthetists. I will take care of your needs.
While in the holding area, your anesthesia provider will come in to talk with you. The provider will discuss anesthesia options with you and give you their recommendation for the procedure you are having. At this time, you will sign the anesthesia consent form.
Do you have any questions? Okay. Thank you very much. The surgeon will be over in just a few minutes to mark your leg and make sure everything goes well. Okay?
Thank you.
I'll see you in just a minute.
If a spinal or other type of block anesthesia is required, it will be done while you're still in the holding area.
Are you ready to do this?
I suppose. Are you?
I think so.
Your surgeon will also come in for a last-minute talk. He or she will go over any details and final questions you might have and mark the surgical site. From the holding area, you will go to the operating room for your procedure. After your surgery, you will be taken to the recovery room. The recovery room is just that. It is a place where you can recover from your surgery and anesthesia. Here, you will be monitored frequently as the staff assesses your vital signs, oxygen level, and your level of pain. You may also have X-rays taken at this time if your surgeon requires them. Joint replacement patients routinely have X-rays taken. If you are a same-day surgery patient, you will go home after your time in the recovery area. Please remember, in all cases, you will need to have someone drive you home from the hospital. Prior to discharge, you will receive written instructions for your care at home.
Sorry we're leaving you with a messy bed.
If you are an inpatient, you will be taken to your room. Your nurse will do a physical assessment and orient you to your room. Pain is normal and should be expected during your recovery. You will be asked to rate your pain on a scale of 0 to 10, where 0 is no pain and 10 is the most pain you can imagine.
How is your pain right now?
Maybe in 6.
6. Are you having any?
It is important to tell the staff how you are feeling so you receive the appropriate treatment to control your pain or other symptoms. To increase your strength and prevent pneumonia and blood clots from forming, you will be asked to sit at the bedside and possibly walk on the day of your surgery. To further prevent blood clots, your physician may order a blood thinner and have you wear compression stockings or calf pumps.
And what they do is just help prevent blood clots, so you don't get any blood clots in your legs.
We encourage you to have visitors. We just ask that you check the hospital handbook for the appropriate visiting hours. If you have a family member who needs to visit outside the posted hours, please check with security and we will make every effort to accommodate them. Remind family and friends that they should not come to visit if they are not feeling well.
Morning. May I come in with your tray?
After your surgery, you may be given liquids for the first day or two. Your physician will decide when you can progress to solid foods.
Some liquid, some soup and pudding and juice.
Okay.
All right?
All right.
You enjoy.
Thank you.
You will probably have some form of therapy after your surgery. The rehabilitation department is comprised of physical, occupational, and speech therapists. They work with you and your caregivers to improve your level of independence. Through exercises and practicing daily activities, the therapists will help you regain strength and function. The rehab team's focus is to find the most effective techniques and devices that allow you to be as independent as possible as you recover. Generally, you will be seen by a therapist on the day of your surgery. This will be followed by a daily therapy routine. While in the hospital, you will have use of our equipment. We will recommend what you should use when you leave our facility. When you are ready to be discharged from the hospital, you may require more care than you or your family can provide. With this in mind, discharge planning begins at your first pre-op interview. During your stay, you may meet someone from case management or social work, or possibly both. They will assist you with planning your return to home and help determine if you need home health care for nursing, physical therapy, or any medical equipment needs. If necessary, they will also help you plan for caregivers, assisted living, or skilled nursing. We hope this information has been helpful to you. Our goal at Shenandoah Memorial Hospital is for you to have a successful surgery and recovery. We want you to have a positive experience. If at any time you have any additional questions or concerns, just write them down and bring them with you to the pre-op interview. Thank you.